when it seems all hope is gone, when people's lives are
Kenya Red Cross has been implementing a sexual and reproductive health project that basically aims at contributing to improve sexual and reproductive health status of women and men, particularly those aged 15 to 24 years. We were targeting those who are living in conflict and post-conflict regions. The project has run for 3 years, a project that started in 2007, mid-2007, ended mid this year. And it is a project that has looked at various elements of reproductive health, has been supported by EU through the Finnish Red Cross, and has run in 5 regions. 2 regions in Turkana North and Turkana South, and Isiolo District, Merti Division, in Joro Division of Nakuru District, and then in Sigor in West Pokot. Now it is Central Pokot. So basically the main reason why we came up with this project is looking at the gloom statistics that surround sexual and reproductive health. You could be aware that every day we lose more than 1,000 women out of pregnancy and childbirth. So, looking at that statistics of women dying, giving life, I mean, it's really a pity. Unfortunately, 90% of those deaths occur in Africa and Asia. The areas where there is poor access to healthcare services. Maternal mortality ratio of 488 per every 100,000 births. So if you look at a small, division, like if you pick a division in Central Province, where we are having like an approximately 100,000 deaths, I mean live births, 488 women will die while giving birth. That is really huge statistics. The most unfortunate thing about this is that this has increased. We are on an increasing trend as far as maternal mortality is concerned. In the Kenya Demographic and Health Survey of 2003, we had 414 deaths per every 100,000 live births. Currently, we are talking about 488. And this comes at a time when we are talking about achieving the Millennium Development Goals by the year 2015. So basically, that means if we are on an increasing trend, as far as maternal mortality is concerned, we are unlikely to achieve this particular MDG 5, which says that at least by the year 2015, we should be able to reduce by 3/4 the maternal deaths. So unless something really urgent is done to reverse this trend, it is very unfortunate that we may not achieve this particular Millennium Development Goal. And definitely this also affects the Millennium Development Goal 4, which talks about child mortality. If you look at families where mothers, young mothers have died, if you look, the maternal mortality mainly affects the young mothers, the young women who are just starting giving birth, the young women who have, young children who are still relying on them. So basically what I'm trying to say is that, an increase in MDG in maternal mortality is likely to lead to an increase in child mortality. May not be direct, but that is likely to happen. Well, for every woman who dies out of pregnancy and childbirth, 20 others experience complication. And complication in this case, we could be talking about, some of them are psychological, some of them are, even physiological in terms of fistulas that we've been seeing, which leads to trauma, stigmatization of the women, and all those effects. So and mainly those maternal deaths are resulting from simple reasons that we can be able to prevent. Severe bleeding, things to do with infections, high blood pressure, things to do with obstructed labor, things to do with abortion gone wrong. And those are things that if we have these health facilities set, we have these mothers sensitized to seek care as early as possible, during pregnancy. Actually, we recommend at least 3 to 4 visits, antenatal care visits during pregnancy. We are able to detect some of these complications long before. And if these mothers are delivering at a health facilities, we are able to correct this. If they come back for postnatal care, care after delivery, this is likely to be corrected. We also look at issues of safe blood for transfusion, because most of the time, especially in this kind of marginalized communities, anemia is very high. During delivery, a lot of blood is lost. Sometimes the mother requires blood for transfusion. This is still part of what we've been doing in this project, especially in Nakuru, where there's a regional blood transfusion center. We also, as part of a reproductive health package, are saying every girl or woman is treated with dignity and respect. This is where we are looking at the issues of prevention of gender-based sexual violence. It takes different forms in different communities. Like you look at a community like West Pokot, I think the main issue that we'll be talking about under gender-based sexual violence would be the FGM. We've been training community health workers. We've been training Kenya Red Cross volunteers who are themselves community members. So we've allocated them a number of households. They do list the number of pregnant women they have in those households. So in total, we've trained 220 Kenya Red Cross volunteers in those 5 sites that we've been working in. 210 Ministry of Health healthcare providers, and 256 community health workers. And those are the people that we want, even as this project, comes to an end. We really want these community health workers and community volunteers to continue sensitizing the community as far as reproductive health, because they have the knowledge, and that's the essence of getting local people who can speak the local language, who have the local needs at heart.